All right, we are recording now. So welcome everybody. Let me just go ahead and share the screen here. Oh, I'm not on the right. I wanted to be up here. There we go. All right, can you all see this now? Yes? Okay.
Yes.
Great. So welcome everybody. This is the 3 Secrets to More Effective Treatment of the Postpartum Body webinar. My name is Lynn Schulte. I'm a women's health physical therapist. I work out of the Boulder in Denver, Colorado, and I am the founder of the Institute for Birth Healing. I'd just like to introduce myself real quick before we get started. I am a mom. I am a single mom of 2 teenage boys, Austin and Justin. They are the loves of my life, and they're amazing young men, super proud of who they are. And I absolutely love being a mom, but I also love being a women's health physical therapist. I've been one for over 25 years. And it's been interesting to see how all the continuing education courses that I've taken along in my career have led and are being applied to the pregnant and postpartum body. So I've taken training in craniosacral therapy, visceral manipulation. I took a course back in 1994 called the Hesh method of treating the sacroiliac joint. And that changed my career. That really changed the trajectory of my career, I would say, because I fell in love with the pelvis after working and learning how to really assess and treat the pelvis from learning mobilization techniques that we weren't taught in PT school. And, you know, in PT school, I'm not sure what they teach you guys in chiropractic school, but in PT school, we had one thumb on the sacrum and one thumb on the PSIS, and we had them lift their knee up and their leg up in the air. And if one moved or it didn't move, that meant there was a dysfunction in there. And that just drove me crazy because I wasn't able to fully appreciate that. But I really, in that course, you really taught us how to spring test the different bones and the motions of the pelvis. And I've been able to use that throughout my career, but most recently, for the past 10 years, I've mainly been working with pregnant and postpartum moms. And I have learned a ton about the postpartum body. And by applying these mobilization techniques to the pelvic bones, I have learned that there's actually common patterns that the pelvis goes through. And there's patterns that the organs go into. And I started seeing these same patterns in pretty much almost every single postpartum client that I worked with. And then I figured out how to release these patterns. And moms started, you know, just amazed at how much better they felt in their body after even as little as one session. And so I started putting up on YouTube all the different things I was finding in the body. So if you're curious, if you go to the Institute for Birth Healing YouTube channel, there's 26 videos that I put up there, and all related to what I'm finding in the body. And these patterns and being able to release them and putting this information out into the world, I started getting emails from women all over the world saying, oh my gosh, I have exactly what you're talking about in this one video. Can you help me? Do you know anybody in my area that can help me with this? And I would send them to their physiotherapist or their maybe a visceral manipulation practitioner. But you know, I'm just like, gosh, nobody really knows or understands what I'm working with in the body here to be able to refer these people out. And that's when I realized that I really needed to start sharing what I know. So that's when I created the Institute for Birth Healing. And I am teaching these courses. I've got a holistic treatment for the pregnant body course, and then a holistic treatment for the postpartum body course. And I've also created a certification process to where you go through you take the 3 courses and then you do the certification process, and you can become certified as a birth healing specialist. And that's going to help you to stand out in your area as being the go-to expert to help moms during pregnancy and after birth. And it really is my goal to create a birth healing specialist in every city in the world. That I'm not going to stop until I do. And I'm going to continue to just keep teaching. I absolutely love teaching these courses. And it's just amazing work that I know is being, practitioners are being effective with learning this information and applying it to their clients, and they're getting the same successes that I've been getting. So I'm super excited. I'm headed back over to Moscow, Russia. So I'm doing my advanced training there. And I'm already got some certified birth healing specialists in the works over in Moscow, Russia, or in the Russia area. They're coming from all over. And it's, again, my goal to get one in every single city, because I know that there are so many moms who are struggling after birth. And they're coming to me, they're seeing chiropractors, they're seeing massage therapists, and they're still in pain. And they lay down on my table, and within 5 minutes, I've got them out of pain, because I know the pattern and I know how to release it. And that's what I want to teach others to have in their hands and in their toolbox, so that they can help moms just the same. So let's jump in and take a look at what's really going on in the body and in the postpartum body. So here we have a picture of this baby in the belly, and you can see how these organs are really getting jammed up. These are the small and large intestines that normally inhabit this lower abdomen, and those are all getting jammed up into the chest cavity area here. This darker red area is the liver, and the liver really should be down a couple inches here toward the edge of the rib cage, and the stomach is over on this side too. And so the baby being in there, especially depending on what the baby tends to use as its kicking bag or punching bag in there, or stretching, their butt gets in there and it pushes up on one side, it can really leave these organs out of balance, and they need help coming back down afterwards. So what moms will complain about it postpartum is that they will have bra line mid-back pain. Their thoracic spine can get restricted in there from all that jamming up of those organs. And sometimes the organs need help coming back down after delivery. So another big issue that moms will complain about, not only midline back pain, bra line pain, but also difficulty taking a deep breath. This isn't as common as the mid-back pain, but it is definitely an issue that moms have, where they can't take a deep breath after they've given birth. And what's happening here is that these organs are just jammed up, and they're crowding the diaphragm. The diaphragm's not able to relax as well, and moms aren't able to take that nice deep breath. And I see this a lot in a lot of my moms. I love this picture when I saw this. But a lot of postpartum moms, people here. There we go. A lot of moms will be stuck in this inspiration type of posture, where all the organs are jammed up into their chest. And, this is that inability to really take a deep breath and to relax afterwards. So, if you really start looking at this, a lot of moms may have a lot of jamming up in their chest, like this gentleman here after birth, and those organs don't always come back down. So our first secret, a lot of times it'll be stuck more on one side than the other. I just worked on a mom today whose baby was totally on her left-hand side, and her stomach energetically was just pushing right on up into her chest. And as I worked on releasing that, she's like, oh yeah, I do have a lot of digestive issues. And so we can help moms release that. So our first secret to help and get more effective in our postpartum care is that we need to get the organs back in place. So our lungs need to be released, and the liver and stomach need to come back down into their original position, and then they need to be rebalanced. So it's the coming back down that is so important to help release that, so that moms can have their diaphragm can have nice effective movement like it needs to for breathing, and stomach and liver can be rebalanced in there, because again, one baby could put more pressure on the liver, another mom may have more pressure on her stomach. I had a mom come to me that was carrying twins, and one twin was directly across in her lower rib cage here, so like right along the diaphragm there, and it was just jammed up, and the whole baby just laid there the entire pregnancy. Well, when she delivered, she was unable to take a deep breath for 2 years. And for 2 years, she was having a hard time taking that deep breath. She came in and I worked on her, and I was able to release her stomach and liver and rebalance it and get her diaphragm released in there. And then she was able to take a deep breath. And I ran into her the next day, and she's like, oh my gosh, I can't believe I'm not hyperventilating, because for the first time in 2 years, I can actually take a deep breath. I've had moms fly in from California because they go and get CAT scans and MRIs and x-rays, and doctors are like, well, there's nothing wrong in there, but yet they still can't breathe. And it's this jamming up of the organs. The doctors aren't aware of mobility issues and how that can really impact our ability to breathe. So in my holistic treatment of the postpartum body course, I teach you how to release the liver and the stomach and how to rebalance them so that moms can bring those organs back down and be able to breathe easier afterwards. So our second secret is that the sacrum needs special attention. Now, I know a lot of you know this already, but there's actually a special pattern that the sacrum goes into that I see in about 95% of my moms. They are, let me show you. How many of you have had moms that have come in, and when they lay down on the table, their right hip is higher towards the ceiling than the left? If you haven't been aware of this, I just invite you to start looking for it, especially your immediate postpartum mom. So moms that are just a couple of months out, you might really see this. I've seen this in moms that are actually 47 years postpartum, and they still will lay down with this rotation here. What's happening is that there's a common birth pattern that the pelvis goes into to get a baby out. And this is what happens to the sacrum. Actually comes backwards here. The ischial bones flare out to the side. And please forgive me, it's either sacral counternutation or sacral nutation. I forget which one, but the sacrum does one at the beginning of birth, and then this is what happens as the baby comes out. And I always get them mixed up, so that's why I'm not going to name this one. But actually, not only does this happen, but there's also a rotation or a side bending or a side gliding, tilting, whatever you want to call this, of the sacrum, where the sacrum moves over to the right-hand side and it gets jammed up in this right SI joint. And this is why right-sided low back pain is much more common for moms postpartum than left-sided low back pain. And what's interesting is that it doesn't matter how the baby comes out, whether it's right LOA or ROA, which way the baby's face is heading, it's usually always to the right-hand side. So this pattern needs help and treatment, and there's 2 easy steps that I teach you in this course on how to get the sacrum down here at the top and over at the right to the left-hand side here. So the sacrum needs 2 nice little gentle motions that help relieve that right sacroiliac joint pain immediately. So this is so common in postpartum moms. So another common pattern in the pelvis after birth is that this whole left side, this whole pubic rami, pubic bone, ischium complex gets really hammered by the way the baby comes on out. When I notice this is if you test and spring and push on the left side pubic bone and then you push on the right side pubic bone, you'll definitely notice a difference. And my theory on this is that let's see, if the baby usually comes in with their nose over on facing the left-hand side, the bigger part of the baby's head is coming through on this left-hand side of the pelvis. And this side is always more hard than the right side. And this can also muscles. So for those of you massage therapists, if you're finding that mom's left adductors tend to be more tense after birth, this is why. And I'm realizing that when bone is not happy, the tissues that attach to that bone are not happy. And by not happy, I mean they're hardened, they're traumatized, like falls, impacts, things like that can cause the bones to not be their spongy, soft, supple mobility that they need. Bones actually are spongy, but when they've been traumatized and pressured, like this baby's head coming through on this left side, it hardens the bone. Like that spongy matrix gets really hard, and it feels way different than the other side. My approach to working with the pelvis is to really help to release the hardness in the bone, and that helps to distribute the forces through this pelvic girdle, the ring that that makes up the pelvic bones. And when we have hardness in here, it actually decreases the ability to transmit the different forces through the joints. And moms who have this common birth pattern in their pelvis, and they get pregnant again, they may have more pelvic pain because of the trauma from the first birth. So we'll talk a little bit more about that in a little bit. But this left side pubic bone, pubic rami, ischium, tend to get more hammered, and so they're harder after birth, and they need to be released. And I teach you how to do that in the postpartum course. Now, another thing that we need to understand is that 1/4 to 1/3 of women report that their birth was traumatic. And that's a pretty significant number there. And what we need to understand is with trauma, there's 3 responses the bodies can go into. We can fight, or we can flight, or we can freeze. And in birth, we can't always fight. We can't fight. There's nothing to fight, and we can't flight. And so the body's only response is to freeze. And that freezing usually happens in that open birthing pattern with the sacrum lifted backwards and the ischium splayed out to the side. And that's how a mom is left with her pelvis after birth. And so many women are walking around in this still birthing pelvis. And so the third secret to being more effective is that we need to be able to clear the trauma from the bones. So these arrows show you which direction, this is that open birthing pattern with, I'd add a little bit of a curve here to the right, because that's where the sacrum goes. And this open birthing pattern can actually cause a lot of problems. And we need to be able to assess to see, is the pelvis still birthing? Energetically, that means that the sacrum is still lifting backwards and that your sit bones are still splaying out to the side. Now, they're not physically doing that, but they're energetically doing that. And when that energy is present in the tissues and the bones, that's what the body still wants to do. So many women are walking around with their pelvises still birthing. And I discovered this in my aunt, who had a 47-year-old son at the time. When I was working on her, I realized that she had the same exact patterns that I was finding in all of my postpartum moms. And I got really curious about that. And I was like, wow, this is exactly what I'm finding in my postpartum moms. And when I started questioning her about her birth, her first son's birth, who was 47 years old at the time, was super traumatic. And that's when I realized that the body holds on to the trauma. The body the trauma is held in the tissues, and the bones are frozen. They're in that freeze response of openness. And what that means for moms is that they will have, because the pelvic floor muscles attach to the lower third of the sacrum and along this iliac or the ischial crest on the inside here, these muscles attach right in here to these 3 bones. And so the pelvic floor muscles are put on stretch. So they're not going to be able to activate as strongly when our pelvis is still open and birthing. And also, moms are going to be at greater risk for prolapsing because their pelvis doesn't have that solid foundation underneath them. So instead of their sit bones being straight down, they're actually out to the side, and the sacrum is back, and that doesn't give as much support to the organs in there. Plus, energetically, the body is still trying to push a baby out. Sometimes when I do internal work, I can actually sense and feel the tissues when I put my finger just on the bladder, energetically that bladder will be pushing my finger right on out. And that's a sign that the pelvis is still burning. The body is still trying to push the baby out. And over time, that's not good for our organs. We need to be able to keep those organs up and on top of that pubic shelf so that they stay supported in there. Another thing that can cause moms problems with this, if they have this open birthing pelvis, is painful intercourse. If a mom's not, that's a huge issue postpartum, is moms have painful intercourse. And if these pelvic floor muscles are on stretch, they're not going to have the flexibility and the mobility that they need for insertion to allow the penis in. The pelvic floor muscles need to be able to expand to allow the penis to be inserted. And if they can't expand, that's not going to happen, and that's going to be painful insertion. And that's a huge, huge issue for moms postpartum. Another thing that I asked moms that I found this open birthing pelvis in them, I started asking them, like, so how do you feel? What do you notice? And their biggest complaint was that they felt ungrounded, maybe a little discombobulated in their life. And I truly feel that energetically our pelvis is our foundation. And when our foundation is not solid, we feel that in other ways. And this feeling ungrounded and discombobulated was a common finding in the moms that I've been working with, that I find this open birthing pattern in. The other thing we need to be aware of is that if mom had a challenging first birth, her pelvis may still be open, and then she gets pregnant again. And now she's trying to carry a pregnancy on an unstable pelvis. And that's where a lot of the pelvic pain comes from in pregnancy. And especially if a mom did not have any pelvic pain during her first pregnancy, and then she gets pregnant again after the first birth, and now she starts having all this pelvic pain, that's a sign that her pelvis is still affected from that first birth. And when you know how to clear out the pattern and help close up these bones, then you can help a mom get rid of that pelvic pain. And I was super excited because I've been able to do this in one session. I've seen lots of pregnant mamas with pelvic pain. They come in, I release this pelvic pattern in their pelvis, and then they walk away and they don't have pain anymore. And I was super excited when one of my students who took my postpartum course was able to do the same thing for her pregnant mama. And the mom came in and she's like, yeah, I don't have pain anymore. And she was like, really? So this massage therapist was really surprised that it was so effective. And it is effective when you know what to look for and you know how to clear it. And that is really what I would like to teach you if you're interested in learning. So you can actually sense in your hands whether a mom's pelvis is still trying to birth by just placing your hand on that sacrum and just tuning into the energy of what that tissue wants to do. You may notice that your fingers lift backwards as you put your hand on that sacrum. Your fingers will just kind of start moving backwards a little bit. And that's the energy in the bones saying, yes, I still want to move backwards. You can also do the same thing on the ischiums. If you put your fingertips on either ischium, you may notice whether or not they splay out to the side or whether they just stay still. We actually want neutral tissue. Our tissues, we don't want our tissues to do anything. That means that they're nice and happy in there. If there's energy in the tissue, that means that there's still stuck something in those tissues and they can't relax. And that's what we really want. So in my course, I teach you how to assess this and also how to heal it and clear it. So if you are working with postpartum women or clients that are still having back pain, pelvic pain, no matter how many adjustments you give them or how many treatments they get, or they continue to leak urine, no matter how many Kegels they do, it's not about the Kegels that stop the urine. Actually, bladders get very tweaked internally from birth, and you can learn how to move them back into the proper place. And that is the key to stronger Kegels. Bladder is the kingpin. I'm learning that when the bladder's not happy, nothing down there is happy vaginally. And once we get the bladder happy, everything kind of gets happier as well and is able to function better. And that's what I'm all about. I want things functioning better. When the bladder's tweaked, it's not able to hold the urine in properly and moms are leaking. Now it's also is about training and retraining the inner core muscles and getting that strong again, but it's also super helpful to get the bladder back into position so that moms stop leaking and get the muscles to be able to activate better so they can have better control. So also, if your mom's been complaining of problems for years after having your baby, then this is the course for you. We're going to teach you how to eliminate pelvic pain by releasing the birth effects on the pelvis, help bring the pelvis out of that birthing pattern. We're going to terminate bladder leakage after birth. We're going to eliminate low back pain in 2 simple, easy steps. We're going to heal hemorrhoids and fissures. We're going to be able to activate stronger pelvic floor muscles without Kegels. You're going to learn how to recognize whether a pelvis is still birthing. Mamas are going to be able to enjoy sex again. This is one of the most passionate things that I love helping moms with after birth. It's like, no, you know, the doctors look at moms who come in complaining of pain with intercourse. You look at the tissues and they say, everything's healed. Try more wine, try more lubrication. And it's not about the lubrication or the wine. It's about getting the muscles happy in there again. When they have scar tissue, when they have trauma in the bone, the tension in the bones, tension in the muscles, they can't relax to expand, to open up. Doctors are not checking mobility of the tissues. They're just checking and seeing that, yes, the tissues are healed. You should be fine. But it's really a mobility issue. And so this course does teach internal assessment work. And the postpartum course does have a full day of doing internal work with the pelvic floor muscles and the organs. And I know some of you may not have the license to do internal work. And I've thought about separating them out and making 2 courses, but I find that doing the internal work, whether you're licensed or not, can inform your external work. And so I feel that learning this internal stuff and being able to feel it can help you appreciate more of what's happening on the outside. And so I've decided to just keep it together and offer it in one course. So do know in this postpartum class that there is pretty much a full day of doing internal assessment work and release work and how to heal that. I also teach how to do external palpation and release work in my pregnancy course. So in the pregnancy course, I only do 2 labs that are internally based, and you learn how to do them externally as well. But this postpartum course, there is pretty much one day dedicated because there's a lot to learn about what's changed and what needs help and support internally after birth. You can still get great information and be able to help mamas significantly if you can't do internal work. So I just want to clarify that coming to this course, even if you can't do internal work, you will still benefit. Your moms will still benefit from you learning this information. So I just had a mama who sent me this email who says, I just have to say I've used your techniques that I learned in class on almost every patient this week. And I think this is the most applicable workshop I've ever attended. Thank you for putting together a powerful, information in a very useful format and being a wonderful instructor. So this made me so happy to hear this, and it is these techniques and these tools that I'm teaching you are applicable for any patient, not just your postpartum clients or pregnant mamas. You can work with it on any person that has back pain, pelvic pain. I teach a whole new way of assessment and treatment of the pelvis and the abdomen. And I feel that the abdomen is an area of the body that is very much not addressed enough in our care for moms, especially women. Any woman who's having any kind of issues, lower abdominal mobility, especially mobility of the uterus and the bladder, which I teach in this course, that you do externally from the lower abdomen, super helpful. And I feel it actually helps the pelvic alignment. I was working on my friend's daughter who has really crampy periods, and her pelvis was really off. She had an anterior rotation one side of her pelvis, and without touching her pelvis, we just released her uterus because it was restricted on that side. When we released it, her pelvis became neutral again. So super important. The body protects the organs first in the body. The body protects the organs, so it's going to compensate with moving the skeleton. When you release the organs, the skeleton can relax. So this is super, the techniques you'll learn in this course are super helpful for any client that you're working with. And so I would love, love, love to let you know about how to become a certified birth healing specialist. There's 3 courses that you would need to take: the postpartum pregnancy, the postpartum course, the pregnancy course, and then there is an advanced treatment of the postpartum body. And there is a certification process. So you take those 3 courses and then you do the certification process. And there's a written exam after each course, just simple questions of information that I covered to just make sure you understand it and know it. And then there's a skills test after each course that we will do a Skype session. You'll need to have a client there that you're working on. And I'm going to just throw out different skills that I would like for you to demonstrate on your client there. And you will need to describe your hand placement, what you're feeling, what your motion is. And it's all written out in your course material, in your workbook. I have really easy laid out labs and a manual for each lab, giving you your intention, the hand placement, your mobilization direction, and how to actually treat. So those will be the skills that I'll be assessing for in the certification process. And then I'm also asking you to write 2 case studies after each course. So I want to see 2 case studies from a pregnant mama, 2 case studies from a postpartum mama, and then 2 case studies involving more the advanced treatment. The advanced treatment actually jumps into more of the energetic and the emotional work that needs to be released in order for mom to have a more complete healing. So much emotion, so much energy is stuck in the tissues of the body that do not release from just physical release work. And when you learn how to really address the emotional and energetic aspect component of it, there's a more effective treatment process that happens. And you really, really do change mama's lives. And I hear it over and over in the women that I work with, that these simple releases that we're doing energetically really do help them to show up in a whole new way in their lives, and they're forever grateful. So it's super powerful work. This is such an important piece of work that moms are not getting. And so I truly feel, for those of you that have your own practice and you really want to take it to the next level and get more clients in the door, this is an awesome avenue for you to be able to expand your practice and expand your reach and bring in more moms. I absolutely love working with moms. They're a really fun population. And with the postpartum work, it's not, they're typically not your chronic pain patients that you have to see forever. They're just a couple of sessions and then they're good to go and they're back into their life again. And it's fun. They bring in their babies. You get to hold babies. You get to, it's just a really fabulous population to work with. So if you are interested in learning more about the courses and when I hold them, the instituteforbirthhealing.com/events. And I have courses that are scheduled in Boulder in August and September. In November, December, I'm offering 2 more pregnancy courses, 2 more postpartum courses. There's actually a postpartum course happening in Portland in November. In January, I'm going to be in New York doing a pregnancy course, and in Albuquerque sometime this spring doing a postpartum course. So I am interested in getting this work out into new arenas, new regions of the states, even other parts of the world. So if you feel like you can gather 10 or more women together, or practitioners together to learn this work, I'd be happy to talk to you about bringing these courses to your area. So I'm going to go ahead and stop the screen share here, and we're going to, there is a chat box here. I'm going to put this link in the chat box, and you guys can click on it. And there we go. So instituteforbirthhealing.com/events. And that is where you find the list of all the courses. And my website, instituteforbirthhealing.com, is getting finalized as we speak. And so there will be more information in the next week or two with that. So that's all I wanted to cover with you today. Do you guys have any questions, any comments? Are you seeing what I'm talking about? What do you hear? So I'm going to unmute you all. Anybody have any comments?
I just want, so the classes are in person, right? They're not like all.
They are. Yes.
That's good, because I'm not a good online learner. I'm not disciplined enough for that. Okay.
I hear you. You know, you know, maybe eventually someday I might put part of the courses online, but it's a hands-on course, and I want to make sure you guys have it in your hands when you leave. And that is one of the things, the way I teach it, there's multiple, you're not just learning a technique once and then moving on. We actually review it each day so that you really leave comfortable with those skills in your hands.
And about how long are they each? Like how many days?
Yeah. So the pregnancy and postpartum course are 3 days, and the advanced course is 4 days.
Okay. And I'm sure the advanced you have to take after the other two, but is pregnant or postpartum one in order?
Yeah. Really, the pregnancy course is level 1, the postpartum course is level 2. But I don't want to stop anyone from just taking the postpartum course. Maybe eventually someday I might do it that way, but the pregnancy course is a really great introduction to the techniques, and then we expand on them and do more different treatment techniques in the postpartum course. So if you have an opportunity, I would definitely encourage taking pregnancy first and then postpartum. But if you are really good with palpating the pelvis and mobilizing the pelvis and working with the tissues, you can just take the postpartum course and jump right into it and be okay. If you're newer to that, I would encourage you to take postpartum or take pregnancy first.
Right.
Okay. Great. Any other questions?
You said that the pregnancy one, the closest one to me, I guess, would be in New York.
I am teaching the pregnancy course in New York, in Brooklyn, January 25th to 27th or 26th to 28th. It's that Friday, Saturday, Sunday weekend. All my courses are Friday, Saturday, Sunday.
Okay. So but you're not in New York prior to then, or you're not in like Philadelphia, New Jersey, anything East Coast-ish, right?
No,
before January.
Not until January.
Okay, and then that would be the pregnancy one. Now, when would be the advanced postpartum?
I haven't, the postpartum ones, I haven't scheduled out the postpartum for 2018. Sorry, someone is really noisy there. I don't know who that is to mute you. Who has all the kitchen background noise?
Sorry.
There we go. We got it. I muted you, Lindy. So I haven't set up the postpartum courses for next year, but, depending on the interest in Brooklyn and January, we'll schedule a postpartum one afterwards for that area.
Okay. Now the $50,000 question, what does this cost?
Yeah. So the pregnancy and postpartum courses are $597. And then the advanced 4-day course is $997. And there is a certification cost. So the certification is $2697, and that includes all of the testing, all of the assessments, and the written coursework, me reviewing that and stuff like that. And I just see a note here on the chat. I currently do not have these courses CEU credit yet. That is my intention to do so. I just haven't been able to figure out when to get that done yet.
Okay.
And I needed to, I feel like I've finalized the curriculum now. Every time I teach it, I learn a little bit more and a better way to teach it. And I wanted to get that finalized before I went through the CEU credit a process. So who was asking that? Is that a PT or chiro or massage therapist? Is that, oh, Callista, massage. Okay. See, and that's the thing. I got to figure out how to get it CEU'd for every profession. So that is, that's going to be a full-time job.
Okay.
And right now I'm wanting to get these work out into people's hands. And so with the courses, you get the schedule, you get the objectives, you get the goals. And in some professions, you're able to apply for post-course credit. So if you do have that and you need some information you don't have, please reach out. I'll be happy to help you to try to get certified afterwards if that's an option for you with your profession.
Okay, my next question would be, if you pay for the pregnancy and the postpartum, the $597 for each one, and then you pay for the advanced of the $997, the certification on top of that is $26?
No. Thank you. Certification, thank you for clarifying. Certification is for all 3 courses plus the testing is at $26.97.
Okay.
Okay.
But since I can only take one at a time, because you're only going to be here for one at a time,
right?
It would be cost effective for me to do them and pay for them one at a time.
Yes, and so then there will be a slightly, so I'm trying to make it more beneficial for you to buy it as a package in a group.
Right.
Yeah, and so there will be a separate certification test option that you'll have to pay for separately for that. Okay?
Right, I got you. Okay.
Yeah.
Thank you.
Great questions, Lisa. Appreciate that. Clarification.
Yeah.
Yes. So is anyone finding any of the stuff that I'm talking about in their, have you worked with postpartum mamas? Have you seen any of this stuff that I'm talking about in their bodies? And if you haven't, then I encourage you to look for it.
Yeah. I'm definitely going to start looking. Okay.
Yeah.
I already do a lot with the Arvigo and the other stuff too, but
yeah,
definitely that right hip thing. I'm going to start looking at that a lot more.
Look for that. Yes. Yeah. And Rhonda, what I'm learning, and I know everybody does their Arvigo a little differently, but my sense with your Arvigo techniques is it's more, it's the stroking and encouragement of normal, getting the tissues back to their normal state. Whereas this approach is more of where's the mobility lacking and let's get the mobility to it. So it's a direct approach into the dysfunction, or finding the dysfunction and treating the dysfunction. So that's it.
I'm glad you said that, because I was wondering how it's different,
it's, I've had several different sessions from different Arvigo practitioners. And for those of you that don't know, this is Mayan abdominal massage is what we're talking about. And there's, to me, it's just more of a general, well, if I do this, a couple of times, that should be able to get the organs back into place or into their proper place. And this is really assessing to see where the organs currently are and feel the mobility and the lack of mobility and getting the mobility back. And so, you know what? I think it's actually a perfect step to do prior to the massage, to the Mayan, and then do the Mayan to facilitate greater evenness in the tissue. So I think that's
what I found. Most things are complementary to each other. It's nice to have. It's nice to have a big toolbox and just kind of put them all together.
I agree. Totally. Great. So are there any other questions? I so appreciate you guys being here with me tonight and sharing. So anything else I say, did it make sense? Okay. Yeah. I think you'll find that a lot of what I talk about and teach is it's like, oh, that makes perfect sense. So anybody else have any questions or comments?
I wonder if that would explain my back pain.
Well, I didn't. So did you have a C-section or a vaginal birth?
I had 3 vaginal and 1 C-section.
Okay. So another key piece to that is C-section scarring really can cause low back pain. There's the sacrum, so the uterosacral ligament. When I have not met a C-section scar that's not tighter on one side than the other. And so that puts tension on that uterosacral ligament that's going to pull the uterus forward because the body's going to protect the uterus first. And so that tweaks the sacrum and gets the sacrum out of place. And then the sacrum can't move as it needs to. It's, going to be sideways in there, and it's going to pull on that sacroiliac joint. And that creates a lot of low back pain. And it's the same, you probably have a combo situation going on there with that birthing pattern, with that sacrum not being happy from the birth, but then also pulling from the C-section scarring. So that's the other thing about these courses is so many moms or, so many practitioners come and take these courses and they actually start healing a lot of chronic pain that they've been holding in their body for years. So, yeah. It's.
I do want to ask you, because we kind of had that discussion on before, and I emailed you about because I think it was on the holistic pelvic care.
Oh, yes.
About the working around, doing the internal work, but working around the anus, because a lot of that I feel like is missed, and sometimes in other classes that's not gone over very much. It's more like in the vagina and that's it.
Yes, that is so true, Rhonda. And I do find that there is a tremendous amount of tone in that anal sphincter muscle. And I do teach how to assess that and how to treat that and release it. And I feel it's super important for moms that are dealing with hemorrhoids and fissures postpartum. I find that the fissures tend to be opposite where the restriction is. So, it's supposed to be nice and tight. And if I have a restriction, let's say I have a restriction here, then this can't open. It should all open up evenly, but if it can't, then this is held down and this happens to open up even more so. And that's what causes the tearing. And that's a fissure, is a tear in the anal sphincter, in the anal canal and sphincter area. And that is super painful for moms. So I get in there and I'll release the anal sphincter muscles on every mom that I work with. And especially if they have tone in that perineal body, the perineal body and the anal sphincter are so intimately connected that you can't treat one without the other. And I treat mine in a way that is very respectful to the tissues, and we learn how to release it in a nice, gentle way. There's no forcing any tissues in my work. And
that's
what I teach. And so I will have my moms that have fissures, I will have them do the release work that I do on them themselves before they have every bowel movement to try to help that fissure to be able to heal better. So super helpful. Totally agree. And there's not a lot of people are going there, but I will with you if you come.
I think we should.
Absolutely. Yeah. So great. Anybody else have any questions or comments? Great. So you can, on that events page, so the institutefobirthhealing.com/events, that page has that you can register right from that page. So it goes into greater detail about the different courses, what is covered in each, and then you can actually register right there. I do offer a 2 payment plan option for courses, so you can. It's $597 if you pay in full, and then it's $307 or $8, I forget which it is, if you do a 2-pay option. So I just want to make it accessible to you to be able to do this, and having that 2 monthly payment plan hopefully can help you.
Yeah.
I don't know what to do.
And also with the certification process, there's also a 6-month payment plan and a 10-month payment plan that'll be available for that as well. So, okay.
Great.
Great.
Thank you.
Thanks so much. Hey, please know that the Institute for Birth Healing is here as your resource. If you have any issues for moms, postpartum moms, pregnant moms that you want help with, I do have a community Facebook page. If you would like to join it, the Institute for Birth Healing community on Facebook, if you just search for that and ask to be added as a member, that's where I answer questions, and we can start discussions and have dialogue about postpartum healing. That's my intention with that group. So please do join us on there. Okay?
Thank you.
Thank you.
All right. Thank you, everybody, for joining. Take care.
Bye.
Bye-bye.